to join me. This is so fantastic.
Yeah,
I figured we'll just dive right in here. And why don't you guys start by introducing yourselves and where you're at and what your practice is called and what you do.
yeah, sure. I'm Dr. Rachel with Uplift Pelvic Floor Physical Therapy. We are located out of Bucks and Montgomery counties, right outside Philadelphia.
Awesome.
And we've both been physical therapists for 15 years. We have strong orthopedic backgrounds, and we are pelvic floor physical therapists. So,
Yay.
yeah, so right now we go to people's homes. We do have an office in Quakertown. And yeah, so we're getting out there in Bucks and Montgomery, and
We're trying to make it as easy as possible for everybody with busy lives to actually take the time to care of yourself. We come to you, we bring everything you need, and then
That's
hopefully
awesome.
you enough of an incentive that somebody's going to show up at your house and make you do your exercises that you do them.
Yeah, exactly. I love that. My biggest question, what made you guys decide that like mobile for pelvic floor PT was the way to go, or what sparked that idea?
It's a great question. We had worked at a big system in the area for a while, and a lot of our moms, especially, were having a ton of cancellations or no-shows because their childcare would fall through, or their kid got sick at the last minute, or they didn't want to bring an infant into a medical facility. And so all of these things kind of just led us to thinking, what was the biggest obstacle for moms or for anybody that we were seeing, really? Having to take 2 hours of PTO to
Yes.
go to clinic instead of having just, oh, I have my lunch break, let me have them come during my lunch break.
right.
So all of these obstacles, we know how hard it is to
Yeah.
take
Oh,
care of
for
yourself.
sure.
And
Yeah.
we're like, well, let's
Yeah.
get those out of the way. Let's let people actually have the ability to take care of
Right.
themselves.
And as moms
Absolutely.
ourselves, we completely get it, and we know how hard it is to
It
take
is.
care. And,
Yes. Yes.
eliminating all the obstacles definitely helps, make you not have an excuse not to come.
Right, exactly. And like I think even just like the stress, like I know how I am even now when I have to go, pick up we still have, three kids, three of ours are graduated and we have three at home still. And so, if I have to go even to like the nail salon or get my hair done, I'm constantly like the ability to relax because I'm like I got to get the kids, I got to take them
Mhm.
here or there or whatever. So that's yeah, then you have like little ones on top of that. And I would think that it's very difficult for them to stay focused or to relax, especially if you're doing pelvic floor,
Mhm.
or relax enough if they're worried about like, I have to get back in and take care of my children or go pick them up or.
Yeah, it's a
Mhm.
very different outlook when you're
Yes.
stressed, how it correlates to the pelvic floor and maybe some pelvic floor dysfunction compared to when you're able to relax and recover a little bit. So
Yes.
we found it's been really great. A lot of
Yeah.
people have been super happy with it. We
Yeah.
do offer the clinic location in case you do want to get out of the house and you
Yes.
want it to be a little bit less in your own home. And we understand both is great.
It really
Yeah.
is. I would be that one that would be like, no, you have to come to my home. I have a wonderful massage therapist that she is a lifesaver and she comes to my house because same thing, even though my youngest is 7 and he can still do things, like when I've had to bring him with me, I cannot relax. There's no
Yeah.
way.
And it's hard to focus.
There's no way.
Yeah, it's hard to listen when you have like you're trying to keep your kid
Yeah.
occupied and whatnot.
Yeah.
It's
Uh,
also really nice. Like, I love finding ways for people to make their exercises that are going to work for them to find a way for them to do it at home and be like, okay, well, this is where you can do this exercise on this little ottoman, or really
that's
be like, okay, well, this works
great.
here, because then it's like they visualize it and they're like, yes, that this I could easily do this in my life, and to be right there to be creative and just find
Yeah,
ways that
absolutely.
for them is really cool.
Or
Yeah.
just being comfortable enough, it's can be such a sensitive, especially if you're doing pelvic floor, it's sensitive.
Yeah.
And so I think for some women it's got to be helpful for them to be somewhere where they're already comfortable too. And then like you said, you can give them the tools in their home and say, oh yeah, this is it's a great area to do this exercise here or focus
Mhm.
on this here. And
Exactly.
so
Yeah.
That's awesome. So a couple things that I was really
Yep.
interested in was when I was looking, at your guys' Instagram was two things in particular. And so the one was because, I do perimenopause and menopause and we're all about bones. And I loved that. I saw that on there. There, you were saying, oh, well, we talk about perimenopause and pelvic floor, but what about our bones? And so I preach this every single day to my patients, and that they've got to lift heavy, that they've got to do, jump training, resistance training to keep those bones really healthy. And so I was really excited to see that. If you guys talk to me about how you teach, your patients to do that, or your thought process on that.
Yeah.
Yeah. So we love being active. We love working out, but we know that some people are not. So if you come to us and you're not really versed in what to do or how to start, we got you. We like to start nice and easy, maybe body weight stuff, maybe a little bit less impactful, especially if you have pelvic floor dysfunction or if you have any kind of incontinence issue. And we
Right.
progress you to the point where your body can tolerate the more intensive lifting and the more intensive impact. But I can get a little nerdy, so bear with me. But
Okay.
the body's such a beautiful system that when you put a stressor on it, different parts of the body then rise to the occasion. So when you're putting that extra stress, whether it's lifting, and so you're putting the stress on the muscle that then pulls on the bone, or that impact on the bone also sends a signal to the brain that you need more bone
Yep.
and you need to get stronger. And we always like to talk about, we're not training you necessarily for tomorrow. We're also training you for 20, 30, 40 years from now.
That's right.
This is where we
That's
start.
right.
And
Yeah.
especially the perimenopause, the menopause, people who are going through this, like we're trying to not only prevent anything else from going any further down that road,
Right.
we
Right.
also want to prevent you from when you're 80
That's
having
right.
any issues. So we're all about function and making sure
Yes.
that you can do whatever you want
Right.
for as long as possible.
Right.
Yeah, I think we forget that, if women are, menopausal, let's say, let's just throw menopause and not perimenopause, when we know that's when more of the bone is turning over and your bone loss is higher in that perimenopause transition. But, if menopausally you're between 45 and 55, I mean, women we're living until our 80s. So that is, 40 plus years that
Right.
we need to take care of these bones. And not only, and if I have someone on hormone treatment, that's definitely going to help. Estrogen helps with protecting our bone,
Right.
but it's not always enough, right? There's still lifestyle changes, or in those women who can't take estrogen for whatever reason, we have to teach them how to protect their bones as well. And so, yeah, that's to your point right there, that it's so important. And those heavy weights, resistance training.
Mhm.
um do you, so when someone comes in, are they coming in for conditioning? Is that, or kind of tell me how that works? Do you get referrals or direct patients that come in just to help strengthen and condition?
That's a great question.
Yeah. So, I mean, we're as pelvic floor specialists, I think the majority of our patients now are coming in because they're having a pelvic floor dysfunction. So,
Mhm.
incontinence, leakage, like something that's really truly affecting their quality of life. But our goal with all of our patients are to get them back to an active lifestyle and make, it work for them in their lives. So if there's a postpartum woman who wants to get back to running, we train them. We work on unilateral strength. We work on, that weight training on the one side, because when we run, we're on one leg, right?
Yep.
So we're always trying to get them back to their prior level of function. And if their goal is to, build bone strength, we're 100% doing that. And we're teaching them how to do it, but doing it safely. Having them breathe at the right times when they move, because that can put more strain on your pelvic floor if you're holding your breath and
Right.
trying to do things. So, yeah, I mean, we're always trying to work towards the patient's goals, and that would be a goal for everyone, is to be doing regular exercise. And, there's so many ways to do it, and we try to just, like, what do you enjoy doing?
Yeah.
Because you're going to do what you enjoy doing. Like, if you love to lift weights, like, great, we can do a full, like, weight training program. But do you really love Pilates or that type thing? Well, there's bands and there's ways that you can
Yep.
still do resistance training and make that work to encourage that bone growth as well.
And I think a really cool thing is we're both direct access pelvic floor PT.
Yes.
So that means that you don't need a referral.
Yes.
You
I
don't
love
need
that so
a
much.
prescription. You can just come and see us. And of course, we reach out to your provider and we do the paperwork on the back end. But that's one of the best parts is that we can see you when you feel you need some help with all of this versus when it's been going on for a while and you finally have gotten through the medical
Yes.
system to us.
Yes.
So that's a
Mhm.
huge thing. And we do see a lot of people who are maybe used to lifting like 5 or 6 pound weights at the gym, or maybe are like a little worried that they're going to
We're
get
scared.
bulky.
Mm-hmm.
And, you know,
Yes.
we are always like, well, strong is functional. The goal
Yes.
shouldn't be skinny. The goal should be
Yes.
strong and functional and being
Yeah.
able to lift your 40-pound kid if you need to.
Yes.
Be able to
Yes.
get that laundry basket up from the basement in 10
Right?
years.
Or
So you
your
need to
your carry on up into
exactly.
and I think
And
sometimes we forget just even those things, up and
yeah,
over our head or
it can be
our
so scary.
groceries. Yeah. Groceries in up the 3 steps, that you need
Yeah.
to get, or just to be able to get off of the floor if you were to fall. I think sometimes underestimating that even, or just the proprioception and we'll get to that, the balance in a minute, but even I've noticed as, a 47-year-old woman that going down my stairs or steeper steps of stairs are
Yes.
far different than when I was 20 and 30. But
Yeah.
be very careful. And, that balance goes really quick, even when you think that you have it.
I
you
think
know?
one of the things that always surprises people is no matter who we see, we put them through a whole process of what is your balance, what is your strength, what is your endurance, what's going on. And a lot of people don't know they have a problem with balance until we kind of prove it to them.
Yes.
And then that correlates to, well, if you're unstable, if your ankle and your knee and your hip are unstable, then that
Mhm.
does correlate to what's going on in your pelvic floor. And not
Mhm.
only that, but to your point, it only gets worse from here, right? So if
Yeah.
we don't address these balance issues now, the chances of something happening later down the road are probably a little higher. So let's get that balance system on board.
Right.
Yeah.
And we can gain strength at any age. I mean, it's never too late to start, and true strength gains take 4 to 6 weeks to occur. You just have to be consistent about it.
Yes.
So it's never too late to
Yeah.
start.
Yes. Oh, I love that. And let's, so I loved the other photo on there, which talked about balance and pelvic floor. And I thought, oh, okay. It all makes sense to me now, but I never, it was just a thing that I was like, how does balance and pelvic floor work together? And so can you guys touch on that? Because I thought that was really fascinating for me.
Mhm.
So our hips literally attach into our pelvis, and our hip abductors and the entire hip girdle, that is what keeps us upright. It keeps us to be able to stand on one leg without our hips dropping. It helps us be able to balance and do really everything our bodies let us do. We just don't think about it until we actually, try to stand on one foot. But that entire pelvic girdle, those muscles, the adductors, are working to keep you upright. So if your hips are weak, which is very common in our population, and often patients are so surprised when we test their strength and their leg goes right down. They're like, what?
Yeah.
But yeah, so working on that hip stability and then carrying that over to one that strengthens the pelvic floor, because our hips attach into the pelvic floor. Their insertion points are, the pelvic floor
Mhm.
itself, because they're rotators and they're, they elevate things. So yeah, so it's definitely huge correlation.
Yeah. So do you work on both of those, and you find that helping the balance and getting a person's balance in check helps with their pelvic floor and
Oh
Absolutely.
my
vice
gosh.
Yeah,
versa?
a huge part of what we do. Yeah.
I
Yeah.
think part of the fun for us is that every person's such a puzzle. So
Mhm.
we can't look at you and say, oh, okay, you're losing PU and you're jumping, do these 5 things. Because those 5 things for me are going to be very different than Nicole's 5 things. She was a gymnast. She's super limber. She can do
Yes.
things that I have literally never been able to
Yes.
do. And I've always been a little bit more of like a heavier lifter kind of thing. So I was a rower. I did a very different thing for my body. So between the two of us, we have very different things going on. So how would I expect your body to be the same?
Mm-hmm.
And so when we then take a look at exactly why is your balance different and how does that relate to your issue in the pelvic floor? It's a misconception that all the time you just have to strengthen that pelvic floor and do a Kegel and have
Yeah.
everything get stronger. sometimes we need that relaxation. So if your body's a little bit too tight and then you're trying to balance, that's also going to force you to be unstable. So I think having the person either in front of us or on our virtual patients, it's really interesting to see how their body compensates, and then we go from there. I think it's nice that we both came to pelvic therapy organically through our long time of being PTs.
Yeah.
And so we have this wealth of knowledge to take a different look at it and then say, here's why I think we really do need to focus on your hips. And sometimes people are like, but you haven't given me anything for my pelvis.
Yeah.
Like, no, I have. It just isn't what you're expecting.
Because
That's right.
it's there. Like, look here. We have our pelvis.
Our best
Yes.
So literally like the hips.
It's
right
all.
here. Yeah, I mean they're connected. It's all the same thing.
And some of your muscles share the retinaculum with your actual pelvic floor muscles as well. So even the ones that aren't exiting the pelvic floor to become rotators, you do have insertion points that make it the same.
Yeah, I really love that too, because I think those visuals are so important. I definitely know I do it with even just my female patients when I'm trying to explain to them the anatomy, the genitalia anatomy, because, they just had no idea. They're like, oh, I didn't realize that not everything is just called one thing, And so I love that really shows you like, oh yeah, your hips are right here and here is your pelvic floor. And it all, if you're shifted or out of alignment and, I'm an osteopath trained, so that's all speaking my language. I love it.
Yeah.
And so, it's, there really is structure and function is so important.
Yeah. We do a lot of education because if you don't know what your body does or what it looks like, then it's difficult to teach that coordination that so many people are lacking. So we do a lot of training that coordination, like what's lifting, what's lowering, what should your body be doing in this time. But, spending time to take the model out and talk about the function. What is the pelvic floor?
Yeah.
There's a lot of hype, there's a lot of talk about it, but what actually is it? What does it do? And we, go over all of that with our patients. And, I feel like they truly understand their bodies a lot better when they're finished.
That makes a big difference. And then, so you guys talk to me a little bit how you do your virtual. That's really neat too. So not only are you going to patients' homes, or they're coming to you, but you will see patients virtually as well. And so that's really nice. How does that work?
Yeah. So, I mean, a lot of what we do is we do a really long history. We get so much information. What is your GI system? What is your urologic system? What is your, past medical history? So even in a regular eval in person, we are talking like at least the first half hour about like what is going on. We really get to know our patients, and so that we can understand what their issues are. So once we understand what's going on and the issues, I mean, we can then look at a lot of things. I mean, we can look at someone's balance as they're standing there through the video, and we're, creative and like, trying ways to test strength, but a lot of it is, habitual things that we're talking about and like what they're doing in their life. How much water are you drinking? Bladder retraining. Like there's a lot of things that we can discuss that can make a huge impact in your life. That's, just by education and talking to each other. So,
and it's nice and convenient. We're only licensed in the state of PA, but we can reach you if you don't have a pelvic floor provider near you, just as you can reach out to so many people.
Yes.
Who don't have menopause specialists near them, which I think is awesome. Yes. And we always, it's a nice option too if you have a appointment scheduled and you don't want to lose it, but then, your kids started puking on the way to the appointment, or, oh, I'm almost there, but don't come in the house. I don't know what this is. And that's fine. We can switch to virtual and still get a lot of work done. And especially if you have any kind of trauma or any bad experience in the medical field, it's okay to tell us, I don't want to do it in person. I would really feel more comfortable being virtually, and we get it. That's fine. Anything that makes you comfortable and anything that you're willing to tell us about your experience is fine. And anything you don't want to is fine too. We just try to make everything as easy as possible. We're talking about really intimate things. We're talking about things that are sometimes a little bit more feeling like a taboo, or should I really be bringing this up? Right. And so anything that makes the patient in front of us comfortable, we're totally fine with.
Yeah. And I think that's really nice for patients too. And I think, even for me virtually, a lot of times they're pouring kind of their heart and soul, and they're talking about very sensitive topics. And so it's nice that they have that option that they can see you virtually, or if they're in an area that they don't, have one, but they're in your state, and
Right.
it just makes it so it, just easier access,
Right.
which is so nice. And
Yeah.
so, so now tell me the best way for people to reach out to you. I know you're on Instagram, but if patients want to reach out to you, or women want to reach out to you, what's the best way for them to do that?
Yeah, so we have a website. It's upliftpelvicpt.com. They can email us, they can call us, they can text us. All the information is on our website that you can reach through our Instagram. So you can find us there through our link tree. But yeah, any form of communication, a lot of people just email and ask us a couple questions, and you can book directly on our website. But if you're, have a few questions first, then you can email, call, text, whatever, is easiest for them.
That's awesome. And do you guys find that, you have a I know there's a lot of younger women, but do you find that some of your women in like this perimenopause and menopause state, that you just get them more often when they're not sure that their issues are related to hormones or a decline in hormones, and then you need to find them someone to help? Or or is it a mix of both, where they've been sent to you by someone that's working with getting them back on their hormones and hormone regulation, and figuring out that that's what's going on, but they need pelvic floor in addition to that to help?
Yeah, I think a lot of our women, like 40s and 50s, I think it's probably 50-50. We're
Hmm.
near a really large metropolitan area, so there are some people who are having physicians who are recommending hormonal replacement. There's also some people who have been like, you really need to talk to your physician about vaginal estrogen, and here's
Yeah.
why.
Yeah.
Um, or, we even have some breastfeeding mothers who need
Who need
hormonal replacement.
vaginal
So,
estrogen, right?
yeah, it's
Absolutely.
like, it's not this horrible thing. Here's the research that's showing all of these wonderful things coming out with hormone replacement. It's not this scary thing anymore. So I
Yes.
think it's really great when we can build that trust to then say,
Mhm.
here's, it's well out of my scope of practice. I am completely fine telling you it's something that I cannot do or don't know enough about, but here's who I think you should go see.
Right.
And I
Right.
think it's wonderful that, there are so many options for that
It
now.
is
Like,
nice. Yeah. It's kind of like, it's the same thing with, referring to physical therapy for me, like I can't do that. I don't know how to do that.
right.
I'm not even going to try. So let me get you to the right people that can take care of you. And, because again, it's not always enough for just what I'm doing for them, but they really, really need some extra support. And so it's nice to have, colleagues in this space to be able to say, yeah, I've got someone in your area I can send,
I
I
think
can
the
send you to. And
combination has
so,
been
Right.
so
yeah,
huge. Like,
Yeah.
I think the people who are getting both at the
Both
same
things. Yeah.
time just see such
yeah,
great results instead
yeah.
of doing only one or the other.
Well,
So I
right.
think that's
Yeah, and I think sometimes you hit just that wall and you're like, we need to bring this in, or I can't do my job effectively without,
right.
you getting some vaginal estrogen on board, or I can't do my job if we don't have the pelvic floor in order as well. And so it's really great. And so well, I appreciate you guys. Do you have any last things for anyone else here watching that you'd like to put out there?
Um, I mean, you guys just keep following us on
Yeah,
Instagram, and
you guys have a great page.
Oh,
yeah,
thank
thanks.
you.
And yeah, if anyone wants to make an appointment or reach out, we're here, and we love talking about the pelvic floor and educating patients, and that's definitely an area that needs more talk
Yes.
about it. And it's
Yes.
such a
More awareness, I think,
more
just
awareness.
you
So
got
yeah,
it.
we're happy
I,
to be part of that, process to
yeah.
spread awareness. And,
Yeah,
yeah.
it's a movement for sure. Because I think just the education, I saw, a couple patients today, and I talked about, I think you need some pelvic floor therapy, and they're like, oh, I didn't think about that. And
Yeah.
and so it needs to be on that radar that there
Yeah.
are, PT isn't just, for rehabbing your knee or your
Right.
shoulder, that there's, other areas,
Yeah.
specifically for women too, that we can use that.
I
So
was like,
I know it's,
common's not normal. If
yes,
you're joking about girlfriends that you're peeing your pants while you're out to lunch,
right.
that's not great. We should
Right,
probably talk.
exactly,
Yeah.
exactly. And, pain with intimacy, whether if it's just a little bit at first, so many of my women will say, well, it's just a little bit. And I'm
Right.
just like, no, it's not supposed to be that at
Right.
all.
And
That's,
like, oh, have a glass of wine, it'll get
Yeah.
better.
yes,
That's terrible
that's a
advice.
terrible
Yeah.
idea.
Let's do something a little bit
Stop
more
that
modern.
from being said. Yeah.
Yes,
Yeah.
yes, exactly. That it all should be enjoyable, that you should not be peeing your pants all the time.
Yeah.
And I love the balance on the pelvic floor and the strength training for your bones. And, we just cannot, all of those things cannot stress that enough, that it's just so important for longevity and health, and
Yes.
just to maximize from this younger age and on through. And so
Right.
that's awesome, you guys. I really thank you so much for your
Oh,
time. I know
and
it's
thank
Thanks
you
for
for your
it's
having
time.
on a
us.
Friday
Yeah.
afternoon, so thank you so much, and we'll definitely have to do it again.
All right,
Okay.
thank you so
Have
much.
a great
Have a good
weekend.
weekend.
All right, you
Let us
guys, you
know.
too.
Yeah.
All
I
right.
know, thanks. Take care. All right,
Bye.
bye bye.